the things we've talked a lot about, these effective therapies, surgical resection, local ablation, chemoembolization, as well as responses with these systemic therapy agents. But sometimes people have a response, but then the cancer recurs. So what do you do when the cancer comes back after treatment?
Well, what can happen that the cancer come back because it's not foolproof. The therapies are very good, very robust, but understandably, the cancer might still come back. The good news is, thankfully, we have choices of therapy. And in other words, if a therapy does not work, it does not mean that's it, we're done. If anything, mostly, if you have a patient that received immunotherapy first, you give them the biologic therapy next. And if the biologic therapy does not work very well, there's another biologic therapy can happen as the third choice of therapy. Believe it or not, we even talk about third line of therapy nowadays. With this said, there has been even some variation on the components of how to treat. For example, on the add-on, if we were to say the scenario that we don't like, but it can happen, what about using immunotherapy more than once? No data yet on that, but definitely something in the works. On the other hand, what if things are so great that we can go back to local therapy? Yes, we can. If anything, we have been, all of us in the field, talk about a two-way street for cancer of liver, because you can really evolve to therapy for more advanced disease, but you can redo the local therapy in case things are better off. So no despair, there's plenty of choices that can happen, and no doubt that patients can carry on with one therapy after the other.
Yeah, no, I think that's all very important, and knowing that there are options, but really depends on the sort of tumor burden when it comes back, and then trying to make your decision between these liver-directed therapies or these systemic therapies. But nonetheless, I think the fact that there are therapies is probably the most important message, coming out of that.